up to 1 kilo.
Despite the reduction in the number of maternal mortality in the country, there is still a huge gap to be narrowed in neonatal mortality, which leads to the deaths of at least 33 children out of every 1,000 births.
That is an area where we have not succeeded as a country when it comes to neonatal mortalities. And I know we know many stories of families who've suffered, who've had children who've had to go through the NICU. And what we have realized, and there have been many studies from a service availability readiness assessment that was done 2 years ago, it showed us that while the country has done well, we have maternal beds, we have Linda Mama, we have the free maternity program, we've expanded it all the way to 1 year. One area of intervention that has suffered is when we look at our NICU beds, is when we look at our investments in the newborn space.
And even with the availability of equipment and technology in the modern health sector, factors leading to these deaths are yet to be tackled.
Causes most of these things is birth asphyxia, difficult deliveries, low birth weights, either preterms or something that has caused you to deliver before the baby is due, intrauterine growth retardations, respiratory distress syndrome, neonatal sepsis. These are things that nobody creates intentionally, but they are things we have to manage.
During the launch of a Children Neonatal Care Center at the Ruai Family Hospital, Health CAS Dr. Mercy Mwangangi said there is a need for financial investment in the health sector to better the available facilities.
Future of health and understanding the spaces of health and the technologies, the disease burden that is in the health sector. You can no longer discuss health without discussing the financing of health. You can no longer have a good doctor, a good x-ray, a good machine, a good MRI, a cyber knife, a PET scan, without discussing the financial end of it. Those two go hand in hand. And so when we see such solutions, such interventions, we want to support them. And I think I'd love to walk this journey with you guys and see where it goes and how that can be scaled up.
The CAS further stated that for Kenyans to get better services, there is a need for the government to invest in its healthcare workers for them to provide proper services.
But a time is coming whereby the healthcare worker will become almost what you'd call a national sovereignty resource that you need to protect and keep intact in your country. They had statistics from the UK, from Australia, from America, from Europe. And the trends and the progressions are showing us that our healthcare workers, particularly those from Africa, will continue to migrate to those regions. And so there's an onus on Kenyan government, and I think this report is to be shared at the AU. Cyril Ramaphosa has started a task force on HR at the AU, and it is an onus on African presidents to start protecting their resource.